Hi, Miss Becca. I am intern Peekaboo. I'm going to be going. It's nice to see you again since our last visit. First, I'm going to start off with summarizing um, what's been going on and what we talked about last time. So I know you're having this right-sided chest pain that's constantly aching, and it kind of goes all the way back into your scalp area. You said it feels like you're being stabbed because it's a sharp pain. It started about 2 years ago. There wasn't really a mechanism of injury or an incident that happened at that time. You just had some 10 out of 10 constant pain since then. You tried acupuncture, adjustments, and over-the-counter medication, as well as ice with minimal relief, and you're still experiencing this. I know it affects like you pulling things and gripping and having to pick things off the floor because it just sends pain all right here and down your scalp region. And I know it's been affecting your work, your weightlifting, and causing some anxiety around this. So that's just a little bit brief of summary of what's going on, and now we're gonna talk about what maybe I can help you with. So last visit, we did a full exam, and you remember you had that coracoid pain test was positive, and you had some limited range of motion and pain with some of those movements. So I definitely think you have the costochondritis going on. I mean, based off of the exam and as well as the MRI you had and brought in for us that diagnosed that. And some of my recommendations are we're gonna do some exercises, some stretches, and other therapies. And we'll go through some recommendations. Definitely recommend you working on your sleep, maybe trying some breathing exercise or meditation before you sleep just to help calm your anxiety and make sure you get some restful sleep, because we do know that anxiety can make pain sensitivity increased and can affect your physical health as well. As regards to red flags, based on your exam and your history, there are no red flags at this time. Just you're having just some inflamed cartilage around your ribs, but no red flags at this time. And if we keep going and we don't see any increases or changes in your pain, we can reevaluate at that 4-week mark. Next, I know your largest concern is not being able to do your weightlifting, and you are getting anxious about your diet and the fear of gaining weight. I do want to reassure you that you're in good hands, and we are going to help you slowly progress back into some exercises that hopefully will not increase your pain or make it worse. And like I addressed briefly earlier about sleep, stress, and other factors that can affect physical pain. We just want to make sure we are practicing good sleep habits, meditation. Maybe we could do some breathing exercises. We can explore that if that's what you would like to do. And then next, to help your costochondritis specifically, I am going to give you just some gentle exercises to start out with. I know we did those wall angels last visit and we weren't necessarily able to do them, but I would like to slowly start being able to do those. So I'm gonna demonstrate them for you real quick. Sorry, let me get into a space. So, like we did on the exam, we're just gonna get against the wall and we're just gonna go like this. Sorry, let me get a better wall. All right, well, okay, like this. And we're gonna tuck that belly button to spine, rib cage to the wall, and just hold. We're gonna hold for maybe 20 seconds and then rest for like 2, and then just do that like 4 or 5 times. And I want you to do that 3 times a day. And then our next exercise or stretch, I'm just gonna do doorway stretches, but really you can do it on a wall. So this really helps stretch those chest muscles. So you're gonna be doing it on the right side, but for demo purposes, I'm just gonna show you how to do it right here. You're gonna take this 90-degree, put it against the wall and just lean and kind of angle this shoulder out so you could really get that deep stretch in those pecs and other chest muscles right there. You're just gonna hold for 20-ish seconds like the last one, then relax and then do it 3 or 4 times. And I like you to do it 2 or 3 times a day. But that's all I have for you. I look forward to seeing you next visit. I will reach out and make sure we do some check-ins. But at any time, do you have any questions for me? Thanks.